what have been realized is that there is only a very small window for interventions if you want to really make an impact on malnutrition in any country. That the damage sets in during the first 1,000 days. That's during pregnancy and then during the first 2 years. And if we can make an impact during this period, we make a difference which will last a lifetime and which will change this vicious cycle of malnutrition. Now in this, in the intervention, what is clearly realized is, although the problem really presents to the health sector, when you look at the etiology or the background factors that cause those problems, that the interventions cannot be limited to the health sector. That a large number of sectors, agriculture or food, social services, education, they have to be involved in the interventions that can actually make a difference to say for indicators like low birth weight. Now let's start with low birth weight. Low birth weight is the start of the whole thing. Now we have a prevalence of nearly 17% low birth weight, although it declined rapidly in the early phase. Since about 2000 it has remained stagnant, and especially certain sectors like the estate sector are very much more affected and have a higher rate. Now when we look at the causations, for example, I'll take one simple example. Now we know that one of the evidence-based factors which contribute to low birth weight is indoor air pollution. You know, like just the smoke from the kitchen to being in the house. So people who live in things like line rooms, which have just the 3 sections, that's an eternal problem for them. And this is a factor that will contribute to low birth weight in the estate sector. So unless we have interventions which are directed towards that, we will not have a long-term or a sustainable improvement in low birth weight. So I just took one example, right? Now household, now for acute malnutrition, especially wasting, we know that poverty or household food security is a major factor. And when you look at this factor in certain sectors in our country, alcoholism of the parents, especially the father, is a major contributory factor. It is as an economic factor even. So unless we have interventions to reduce alcoholism, we are not going to achieve household food security. So I just took 2 small examples to show that the problem, if we are going to tackle the problem, an intervention mediated solely through the health sector is not going to work. So just 2 messages, that if the interventions have to be during a very short window of opportunity, which is during the first 1,000 days, and whatever interventions we do within this first 1,000 days have to be multi-sectoral in nature. When we say multi-sectoral, it's not that each sector will act on their own. They have to act collectively after identifying the problem in order to minimize that at family level, divisional level, district level or provincial level. And we have had a initiation for this already. Pilot projects have been done in Nuwara and Monaragala, and the initial feedback from those projects seems quite satisfactory, and we are in the process of trying to scale up these projects to a nationwide level.